located near the bottom of the control panel. Please go ahead and submit your questions during the webinar. We will answer as many of the questions as we can at the end of the presentation. If you cannot hear us, please do let us know through the chat box. Again, welcome everyone. I'm Jasneet Sharma. I'm a senior community health planner with the Health Policy and Planning Program at the San Mateo County Health System. We will also be having, we're going to have two presenters for today. There is Shireen Malik-Rabzali, who is the Senior Manager for Policy Planning and Equity, and myself, Jasneet Sharma. Just to quickly run over today's agenda, our presentation is divided into three parts. Shireen will first present on Get Healthy San Mateo County's mission and strategic priorities. I'll then review the purpose of the community implementation funding and go through various sections of the RFP and the requirements of the funding application. Shireen and I will then answer your questions at the end of the presentation. All right, so I'm going to hand over the presentation to Shireen now.
Hi, everyone. My name is Shireen Malik-Rabzali, Senior Manager for Policy Planning and Equity, and I get the pleasure of working with Jasneet and the wonderful Health Policy and Planning team here at the San Mateo County Health System. We are very excited to have recently released a new strategic plan, and I hope that all of you on the line have received that plan. And if not, please make sure that you chat in or email us separately. Rosa Torp's email can be found on the strategic plan and on our website, and we'll make sure that you get a copy of it. It's on our website. If you click on the Get Healthy San Mateo County webpage, the opening page will have a link to the strategic priorities. Many of you on the line will have participated in the actual process for which we developed our priorities, and we really appreciate all of the support and participation that you gave us. I wanted to just start by reminding folks that the Health Policy and Planning Program facilitates the Get Healthy San Mateo County initiative. Get Healthy San Mateo County is a local collaborative of community-based organizations, county agencies, schools, hospitals, cities, working together to advance healthy, equitable communities. It started about 10 years ago as part of the Healthy Community San Mateo County Health Improvements to Eliminate Health Disparities effort, which was championed by the San Mateo County Board of Supervisors and many community and city leaders. In 2010, we released a set of strategic priorities focused on improving food and physical activity environments with a specific focus in schools. And now in 2015, with the close of the 2010 plan, we have just released our new strategic priorities, of which many of you were engaged in developing with us. Before I go any further into the mission and the priorities, I just wanted to situate and contextualize our work within the health system. We are a complex system, we are a big system, and the majority of our focus is on treatment and services at the bottom of your screen. We have the medical center, we have 9 clinics, in-home support system, and many other programs that support residents when they are ill to help make sure that they can maintain their health, get treatment when they need. We also have a deep focus on prevention in a multitude of ways, one of which is through healthcare prevention. So you'll be familiar with children's well visits, with screenings, with preventative care visits to the doctor's office. We also do education, so helping people help themselves. We help teach people how to best take care of themselves. So there are times that even at the doctor's office you might receive a list of things to do when you get home. We share information about how to eat healthy, how to get physical activity. We do flyers, exercise classes. Where we focus our work at Healthy San Mateo County is in the top portion of your screen, which is place and policy. We work to develop environments that facilitate health and create opportunities for everyone to be healthy and prosper. We believe that health begins where you live, learn, work, and play, and health policy and planning and the Get Healthy San Mateo initiative are focused at this intersection of health and place. That brings me to our mission, which is to support policy change to prevent diseases before they begin and ensure everyone has equitable opportunities to live a long and healthy life. Get Healthy San Mateo County will be successful when all residents, regardless of income, race, ethnicity, age, ability, immigration status, sexual orientation, or gender, have the opportunity to reach their full potential. Just to take us through the numbers, some of you will be very familiar with this and have been working on many of these health issues throughout your work. San Mateo County overall has health challenges. 77% of our adults are overweight or obese. That number is about 1 in 3 children in San Mateo County, which is highly problematic. Our diabetes rates have increased 10% over the last 15 years and are continuing to rise. 18% of our adults have asthma, and that number has doubled in the last 20 years. And right now, only two-thirds of our youth fail to meet physical activity fitness standards, and this is unacceptable. While these health challenges are not great, when you look countywide and across the state, our county does fairly well overall, health-wise. And then when you look at the health inequities, there's a sharper view on the challenges that San Mateo County faces. And one statistic that shows that best is average age of death. When you look at average age of death across ethnicities, you find an almost 20-year difference between the white population versus the Pacific Islander population. So there is something that is happening, whether it's place-based or health inequities, that is holding some of our ethnic populations back, and we need to identify what that is and help support that process. We also see health disparities and differences by place. So there's about a 19-year difference between East Palo Alto and Atherton also. So there's something happening there across place and race that we need to be paying attention to. This is particularly important because in 2000, the San Mateo County became a majority people of color county as a whole, and that trend is growing. By 2050, the majority ethnicity will be Latinos, and 2060 it will be Asians. Therefore, the health and economy of our county depends on the future health and opportunities of people of color. So moving from that to our framework, you'll notice that place-based prevention, of which I mentioned, advancing health equity and collaboration are really 3 of our key frameworks that we promote all of our work through. Advancing health equity means that not everyone in San Mateo County has the same opportunity to live a healthy and long life. Health equity ensures that all people have the opportunity to advance well-being and works to address the root causes of poor health, such as social, economic, physical conditions around us. And you'll see that highlighted in our priorities going forward. Collaboration is both a technical strategy for us, but here it's highlighted as a value. So as a value, we recognize that there are many communities in San Mateo County, many ethnicities, many geographies, and we can't be everywhere, and that many community leaders know their communities best, know the aspirations of their populations, and and partnering with them, helping support and resource them is how we're going to reach our big priorities around creating healthy, equitable communities. That takes me to what does it take in San Mateo County to create healthy, equitable communities? When we did 5 workshops in the spring of 2015, we asked the question of your vision of a healthy, equitable community. What we identified is that there is a lot of consistency across geographies, populations, disciplines around the key components of healthy, equitable communities. The top 10 issues, key components are listed here on your screen and will likely not be a surprise to you if you participated in our efforts. Then what we did in our strategic planning process is we looked at the data. We also assessed best practices across the nation for those organizations and foundations that are trying to advance healthy, equitable communities to identify what strategies are they focused on. We also talked to our regional health departments as well to identify best practices. And then we put out surveys. We put out surveys online, in person, in 5 different languages, and supplemented with focus groups to ensure that we could reach over 400 people to ask the question of how you would prioritize these 10 components and whether or not there were new and different components we needed to address. What we heard from you and across best practices as well as the research was that the 4 key priorities to create a healthy, equitable San Mateo County were stable and affordable housing, complete neighborhoods that make it easy for residents to be healthy every day, high-quality education in healthy places, and a strong local economy that enables household financial security. Now what I'm going to do is just take you through each of these components and why they're key to health. Before I do, I just wanted to make sure that you had a solid connection between health and the key priorities that we are identified. You'll see data here that supports the fact that each of these key priorities are in fact directly related and connected to health outcomes. You'll find much more rich research on our website. When you go to Get Healthy San Mateo County, you can click on the top navigation bar under Research and Resources, and you'll be taken to a list of 6 topics, one of which is health, another is demographics, and the following 4 are the 4 priorities that were listed in our previous slide. You can get much more deep research on why the connections between health and the 4 priorities here. Healthy housing is really a cornerstone of a healthy community, enabling people to build roots in a community, get to know their neighbors, build a social network of support, and become civically engaged. Right now, over the last 5 years, we have seen rents in San Mateo County raise over 70%. And when housing is not affordable and stable, people are forced to make really difficult decisions, which start by paying unaffordable housing costs, which then divert often limited wages away from important household needs such as healthy foods, medical care, transportation, and child care. And then when the housing costs become even more difficult to sustain, people double up, triple up into housing, which then can create a situation where mold can grow, where overcrowding happens, where asthma triggers are enhanced, and frankly, communicable diseases are more prominent, such as tuberculosis. Then when that becomes difficult, people accept unhealthy and unstable housing conditions. They move into places that are substandard. They may not have a kitchen to cook in. They may have exposed electrical wires. They may have mold growing, vectors, and other issues that impact health. And then finally, when even that becomes unaffordable, what we see is people are displaced from their communities into other counties. And they're displaced from their social networks, from their children's school systems. They experience stress They disrupt their social support systems and even creates job instability if people can't commute back into their jobs. And then what we see often is what many of you see every morning on the bridges and highways into San Mateo County, which is that we exacerbate our existing congestion issues. We have 60% of our workers commuting into San Mateo County. This means longer commutes. This means increased air pollution, increased asthma, and other respiratory and health issues. So our goal is to see that all residents have stable and affordable housing and that household income comfortably supports families and individuals' basic needs. We have a multitude of action steps to be able to advance that strategy, some of which are listed up here, and you get a more robust list when you visit our website. We have healthy neighborhoods as a key priority. If you consider that if you could walk your kids to school 15 minutes and walk to transit to get to work, you're getting your daily physical activity that the Centers for Disease Control and Prevention require to live a healthy life, and so are your kids. And so you don't have to worry about expensive gym memberships where you're trying to carve out an extra hour in the day. Instead of your commute in the car where you're sitting and sedentary and alone, you're in fact walking and beginning physical activity and getting your physical activity that you need. This means that people have to live near where they work, and we need transit that supports our connections between workplaces and homes. This means creating vibrant and complete neighborhoods where it's safe to walk and bike, where you can purchase your daily goods and services such as healthy foods, you have access to affordable public transportation, parks, and open space. We also know how important that small businesses are. They stimulate a local economy and ensure that people have access to their daily needs. Right now, what we see is that 80% of San Mateo County workers drive to work. We'd like to see that change. We'd like to see that people can get their everyday physical activity through their daily commute. Right now, we also see that 40% of our bike and pedestrian collisions are happening within a quarter mile of schools. That's highly problematic and doesn't encourage people and students to be walking to and from schools. We also know air pollution is detrimental to health and well-being. Right now, driving is the cause of 50% of our greenhouse gas emissions, which create climate change. And what we know is that high-poverty neighborhoods have fewer access to healthy and affordable foods, and that right now, 1 in 3 of our kids in San Mateo County drink at least 1 soda a day. These are things that we'd like to see changed with the goal of all residents having access to active transportation and healthy foods in clean, safe, and stable communities. Again, a list of action steps are highlighted here with more found on the website and in our strategic plan. A third priority for us is healthy schools. What we know is that educational attainment is a key factor in determining lifelong health. Unfortunately, differences in access to education begin early in life. Preschool is often inexpensive or unavailable for children from low-income families, making them less prepared for starting school. Right now, by 3rd grade across San Mateo County, what we see is that 43% of our students are not meeting 3rd grade reading proficiency levels, which is a predictor of high school education. We also know that while most schools have wellness policies, that they're not being implemented in robust ways always, and not being implemented equitably across places. Coming back to this issue of inequities, what we find is that while across the board we need to improve 3rd grade reading levels, reading proficiency levels, that number is very different in different school districts. So in Ravenswood School District, only 22% of students meet 3rd grade reading levels, while in Hillsborough City Elementary, 89% meet reading levels. This is both discouraging, but also encouraging in a way that tells us that we in the county know what to do to make sure that all of our kids have a high percentage of reading level at 3rd grade. We just need to implement those evenly and fairly across the districts. So our goal is that all students have access to high-quality education that is continuous and equips them with success in their careers and in health. Action steps are listed above and can be found more in your strategic plan and the website. Finally, but certainly not low on our list, is a healthy economy is critical to advancing healthy, equitable communities. Access to income and wealth is one of the most important predictors of a person's health. The less money a person makes, the less opportunity they have to be healthy. And despite the current growing economic boom in San Mateo County, income inequities are increasing. Blacks, Latinos, Pacific Islanders experience higher rates of unemployment compared to whites, largely due to low access to stable jobs and benefits. And stable employment, adequate income, and benefits can help build financial stability and improve overall health. When families know they have a stable income coming in, they have far less stress and subsequently less health problems. What we know is that when we look across the board, the majority, if not all, of our health issues are highest among low-income people. So when you look at cardiovascular disease, asthma, obesity, overweight, and diabetes, all those numbers are highest in our low-income population. And places with income equality tend to be healthier overall, and that's what we find in national and international research. So what we hope is that all residents can increase income and financial security and have access to well-paying jobs, and that vibrant small businesses are able to thrive, as mentioned in our Complete Neighborhoods priority. Lots of ways in which to do that, some of which are listed above here, and more can be found for you in our strategic plan on our website. There are many ways to reach these goals and priorities. The ways in which health policy and planning and Get Healthy San Mateo County focus our attention is through policy, by providing evidence-based policy tools to change places where people live, learn, work, and play, advancing health equity, through planning and engaging in relevant city and community planning processes, through providing resources and support to our organizations and partners in cities and hospitals and schools that are advancing these priorities, through research, through capacity building, and through communication, effective communication of the importance of these priorities across our county. With that, I'm going to turn it over to Jasneet Sharma to discuss more about specifically the resourcing tactic that I just mentioned, and we'll have time to come back to question and answer after her presentation. Thank you.
Thank you, Cherie. So as you can see, over the last 10 years since the launch of Get Healthy, we have made great progress in preventing disease and ensuring that all San Mateo County residents have the opportunity to live long and healthy lives. However, more work remains to ensure everyone can live a healthy life. To help accomplish some of that, Get Healthy San Mateo County awards funding for place-based primary prevention and health equity efforts. The focus of this funding is to improve the health of San Mateo County by building healthy, equitable communities. Typically, the funding for organizations has ranged anywhere from $3,000 to about $35,000, with a total of 10 to 15 organizations receiving funding every year. We expect to fund only a few projects at the higher levels. Also, every effort will be made to fund a diverse portfolio of projects. Projects at the earliest can start in February and must end by January 2017. This may be different for schools that run on a different calendar year. If selected as a recipient, a school project may begin earlier if your organization is able to cover the costs. Funding, however, will not be available until February. Also, if for some reason your school project needs to start and end on a different timeline than what we've mentioned here, then please let us know and we'll be open to exploring a different timeline with you. The timeline includes the time frame for carrying out the project, including completion of evaluation and reporting. I wanted to talk a little bit about some of the applicant and project eligibility. If an applicant is a nonprofit or a local government organization, including schools and school districts, you can essentially be the fiscal sponsor as well. However, if you're a group of individuals or a program that is not an organization, then you must indicate a fiscal sponsor that will sign the contract, receive and manage funds on your group's behalf. We also have minimum project eligibility criteria as well. This requires that all applicants must, firstly, the projects must align with the Get Healthy San Mateo County framework, which essentially means, is it a place-based primary prevention effort where you're trying to create healthy places that prevent people from getting sick in the first place? And does it address health equity by creating conditions that offer everyone the same opportunity to live a healthy life? In addition, to what extent does your project benefit at least one of the priority populations, which we usually categorize as low-income neighborhoods, communities of colors, seniors, children, and persons with disabilities. Low-income and communities of colors typically have the highest rate of obesity and preventable health issues, and older adults, children, and persons with disabilities face very specific challenges to healthy living. In the application, you would also be asked to choose at least one priority area that your project addresses and describe how the project aligns with the Get Healthy San Mateo County priority area objectives as well. A little information on the type of projects that we do not fund. If it's an existing program or a staff position, we would not fund it unless and until you can show that the existing position has seen a significant expansion of their responsibilities or the program is being expanded in some way as well. We would not fund a majority of consulting fees and or staffing over 50% of the total requested amount. We typically do not fund individual educational classes that do not advance policy or system change. These would be nutrition, cooking, dance classes, safety, and fitness classes. But things like train the trainer and capacity building models, such as training community leaders or staff members in schools to lead education work, are eligible. We would typically not give partial funding for a project for which the majority of the additional funding has not been secured. So while we do not require a match, we do require that the additional funding has already been secured before you apply for our funding. In addition, if the majority of your beneficiaries are outside San Mateo County, the project would not be eligible, and indirect expenses should not be over 12%. We do have a projects funded to date document on our website. If you want more information about what kind of projects and organizations have we funded in the last few years, you can find that on our website as well. Some of the other things that you would be required to address in the application is a couple of narrative and essay type questions. I've already talked a little bit about the first two, is the extent to which your application or your project aligns with the Get Healthy priority areas and the extent to which it benefits the priority population. The other ones, which are project impact, your organizational capacity, any challenges, sustainability, and the work plan, timeline, and budget, I will be giving I'll be digging into these a little bit more in the following slides. As you start to think about your project and the application as well, one of the key things that we'll be looking at is the project impact. When describing project impact, think of which objectives specifically your project will help advance, and also think of the outcomes, meaning the extent to which the project will help improve health of impacted populations or lead to a policy, system, or environmental change. The application will also ask you how impacts or successes will be measured. Now, we do realize that health impacts and even policy change can take a long time to achieve. These are long-term outcomes and difficult to achieve within a one-year funding time frame. but your project may result in some interim impacts that will help lay the foundation for long-term environmental or policy level change. You should identify these impacts and indicate these interim measures as well in your application. Some outcomes that you may have from your projects could be a policy level outcome, a policy or a system level outcome where a policy or new policy is actually developed, adopted, or even implemented. As a result of some activities that take place, you might even see a shift in some social norms where, as a result of which, people have additional knowledge, new awareness, or a shift in attitudes and values as well. Another outcome that could happen as a result of your project is a change in the social, physical, or environmental conditions that improve or promote health. And some of this that could happen could be through a new pilot program that you put in place, a new service, or even new infrastructure to make some of those healthy opportunities easier. We've developed a resource to help you identify outcomes from policy-focused work and choose appropriate assessment methods to measure those outcomes and impacts. This document called the Assessment Methods for Policy and Environmental Efforts can be found on our Get Healthy website as well. I just wanted to quickly share an example with you to help elaborate what kind of objectives you might want to look at, or how the project impacts might look as you are thinking of your projects, and even how you might want to fill out those applications. So the example that you're seeing in front of you is, say you have a project that seeks to engage youth leaders from high schools in a youth-led action research project to determine the public transit needs of residents in the neighborhoods and surrounding the high school as well. So as part of this project, some of the activities that the youth could be involved in would be undertaking research, gathering data, conducting surveys. They might even go through some training as well, and then even making presentations to maybe a city council or a neighborhood group. Based on that, I've identified 2 objectives that are listed here. Your project could have a lot more objectives than this, but you can see the first one to some extent aligns with one of Get Healthy's objectives as well, under complete neighborhoods. And the second one, which is access to high quality education and well-paying job opportunities, is important as well, because when we talk about public transit, we know that public transit gives us access to jobs. It gives us opportunities to apply for jobs in different places, and we're not always dependent on, shouldn't be always dependent on traveling by car. So you should not have to spend a lot of your income towards traveling just by car. So having affordable public transit to get to your place of education or your workplace, could be a project objective as well. I've also listed some expected project outcomes and how you might measure some of those. So as you can see, the first 2 essentially deal more with the policy level outcomes that you might see, and the third one, clearly it lists a health-related outcome out of your project. As you can see in the first example, policymakers might have increased awareness of the intersection of violence prevention, poverty, and active living. It depends on the nature of your project though, but if the neighborhood is not safe, there's a lot of violence that the students encounter in their everyday lives as they're traveling back and forth to school, or even something that the residents go through as they're traveling to their workplaces. This kind of research or this kind of project can help create awareness around that. The way you would measure such an outcome is the number of times the issue could be discussed or raised by policymakers at a public meeting. That could be one interim measure to measure it. Policies to create places that promote all modes of transportation or advance investment in affordable public transportation. This would simply be by the evaluation of policy documents or action by policymakers. Finally, some health impacts would be around the level to which residents can engage in healthy opportunities. If people now have access to affordable public transit, they can actually walk to and fro, that last mile where they can walk to and fro to the public transit, and they're actually getting their everyday physical activity as they're walking and biking to and from public transit. It would also lead to financial stability and improved health. Now that most of their income would not be going towards just using their car as the only mode of transportation, they will have more money or income to spend towards their basic needs as well, which could be either towards medical care or their grocery needs as well. The application also requires the submission of a project work plan. You can use the project work plan template included in the application to list all activities, key deliverables, and timeline for completion of activities. The project end date in the time frame for completion should reflect the conclusion of all activities, including program evaluation and reporting. The sample work plan that I've given on this slide is for the same example that we saw earlier. You can see how all the activities have been listed and explained. It would range from recruitment of the youth, training series, conducting the research, the community assessment, and then dissemination of findings and recommendations. And you would have to identify the time frame for completion of each of these activities as well. A final work plan detailing the project deliverables will be developed collaboratively during the contracting process. You should also use the budget template provided in the application to list the budget requirements and the breakdown as well. A quick review of the evaluation criteria to see how we will be evaluating the application. The first one would be related to innovation. We'll really be just looking to see if the project that you're suggesting or putting forward utilizes a new and innovative approach to address the problem. We've already talked about project impact, but just to recap, impact here would mean the extent to which your project improves the health of the impacted population, likelihood the project would lead to policy, system, or environmental change, and the extent to which the project will help achieve priority area objectives. Also, be sure to talk about the opportunity for change. Why is this a good time to take on the project, and the extent to which your project capitalizes on some realistic opportunity that's taking place within the community where you're going to apply the project. You also need to clearly identify outcomes to evaluate whether the objectives have been achieved and how you're going to measure those outcomes. And then project success. The first one we'll be looking at is the organizational feasibility. And that essentially says, the skills, capacity, and resources available to your organization to undertake the project. With project and operational feasibility, we essentially be looking at is how effective is the work plan and the timeline that you have suggested. Can it actually be accomplished in the one-year timeline that you have listed? With operational feasibility, we'd really be seeing the extent to which the proposed project can help solve the identified problem. And then we're also looking to see are the appropriate partnerships or coordination of efforts in place to support the advancement and success of the project. If you're selected as a funding recipient, there are also certain reporting and participation requirements. These include participating in the Get Healthy Funding orientation event where contract expectations and guidelines will be reviewed. This would happen sometime at the start of the contracting period, which would be in February. Quarterly check-in calls, basically to discuss any progress or challenges that you might be encountering and seeing how we could be of assistance or support to you. We also require a progress report at the 6-month mark and then a final report at the end, which essentially would talk about some of the lessons learned, to what extent was the project successful. Also, we require you to participate in 2 of the Get Healthy forums, one that happens in spring and the other one that happens in fall. These forums are an opportunity to deepen knowledge on the Get Healthy focus areas, connect with other local organizations and people working on similar issues, and continue the conversation with the Get Healthy team. Applications are due November 6th before 5 p.m. and I do want to point out, this is really important, is that we have put in a new system in place. All applications need to be submitted online this time. And it's very important to note that our system does not allow you to create a login or save your application as you work on it. So what we recommend that you do is, we do have a Word version of the funding application. It looks exactly the same as the online application. You should download a Word version of the funding application, absolutely complete the funding application, the Word version first, and when and only when you have completed it and you're ready to submit things online, you should cut and paste and submit information into the online system. I do want to quickly review the online system with you once. I'm just going to pull it up. When you're ready to submit the application online, you should go to the Get Healthy San Mateo County webpage, and under Find Funding, you would select the Community Implementation Funding tab. Scroll down to where it says RFP Funding Application and Process. This would have all the same information that you would see within the Word application as well. We've repeated it all out here as well. You can download the RFP, a PDF version of the RFP here, and this is the Word version of the funding application. When you're ready to submit the application, as in you've completed the Word version and you want to submit it online, you should click this button which says click here to apply online. It will take you to the online application, and this is what it looks like. It has a tab up here which lets you see your progress throughout the application. And again, it has all the similar information that you will see in the application, where it says, review the RFP first, download the Word document, and then cut and paste your information into the online system. When you're ready to move further, you just click on Complete Online Application, and it would take you into the application itself. I do want to point out that we have a note up here on the top which says, do not use the web browser back and forward arrow buttons to narrow through the application. What that essentially means is these arrows that you're seeing on the left-hand corner, the top, please do not use those, because that sometimes causes the information to vanish when you refresh the page. So as you fill out, cut and paste your information into each one of these cells, you will see these tabs at the bottom of each one of the web pages, which you should use to navigate through the online application. Again, if you're having any problem accessing the online system or you're facing any challenges, please do contact us, and we'd be more than happy to work with you. Just a quick overview of the review and the selection process. Once we've received the application after November 6th, the applications will first be screened by topic area experts, and we want to see if the applications meet the minimum criteria, which is, does it benefit the priority populations, and does it address at least one of our 4 Get Healthy priority areas. The applications will then be reviewed by a Get Healthy Funding Advisory Committee, and award notifications would be by December 18th. We also do offer technical assistance. So for the RFP process, if you have any questions, you want to discuss project ideas, we'd be, we are more than willing to give you technical assistance and support there. For funded projects, that is, if you are awarded funding and you do have a contract with Get Healthy San Mateo County, we offer technical assistance in the form of strategic thinking, presentations, training, sharing of resources. FAQs about the RFP and information that will be relevant to all applicants, and a recording of this webinar will be posted on our website. I do want to remind everyone that if you have any questions, now would be a time to start submitting it. And just in closing, you can download the RFP, our funding application, and our strategic plan and additional resources from the Get Healthy San Mateo County website under the Implementation Funding tab. And again, if you need any more information, you can always contact me, or you can contact our program coordinator, Rosa Torpes, as well. So thank you so much for joining us today, and I'd like to open it up for any questions that you all may have now.
Please don't be shy. This is Shireen Malakavzali. We are here to answer your questions. We certainly, you certainly have a chance to get a hold of us after this. You have the email addresses for Jasneet and Rosa, and many of you have connections to other staff. We are also posting an FAQ from the questions that we receive from our in-person forum, as well as other questions that are coming up that we'll be posting and updating regularly on our website. But we know that many of you have ideas in mind. Many of you have been reviewing the application for the RFP. For some of you, this may be the first time you're hearing about our strategies, and we're here to answer your questions. There's a question here, where does this funding originate? Is it considered government funding? This is local government funding. It originates from the county. It is part of the Health Policy and Planning Program, the Public Health Policy and Planning Division of the health system, and is approved by the Board of Supervisors. Thank you, Stephanie, for the question. So we have a question by Brittany that there is an existing program of which the content of which sounds like it's new every year. Would the program be considered? We are interested in supporting new programs, though it's hard to know what exactly is existing and what would be new on content. So if there's a structure that has not previously focused on place-based prevention, on health equity, on the 4 priorities, and that content is brand new and it fits into an existing, for example, youth engagement, youth organizing framework that has continued on for some time, we would certainly consider that as an opportunity. And thanks for the question, Brittany. So we have another question by Ellen. There's a consideration for projects that benefits walking and indirectly supports seniors, low-income populations. Must the project benefit populations that are vulnerable? Yes, the project must have a focus on vulnerable populations, of which are listed in the community implementation funding document. That said, we certainly support projects that would, in addition to supporting vulnerable populations, have broader impacts as well. There's a question by Sonia, under Healthy Schools objective, would your organization consider funding a project requesting funding for a portion of the time of an instructional assistant that would help schools support reading in K-12 grades? So this sounds like it might be an existing project or an effort of which we do not support existing and ongoing efforts. This is a small amount of funding, and what we like to think of it as an opportunity to pilot something, an opportunity to expand on an existing effort, or expand into the new arenas of work that are the priorities of the 4 priorities of Get Healthy San Mateo County, or new populations of people. In addition, it's unclear we don't have the details necessarily, Sonia, but it does sound like this might be more of an individual type support system, sort of not a train the trainers, but individual education of one particular child or another, and of which we are not supporting. We do support broad-based educational opportunities and engagement, but not individual education. Great questions. So please continue to submit them. We have plenty of time. We have just under 10 minutes remaining, and we'd be happy to answer any questions that you have. As Jasmeet mentioned, innovation is also an important factor for us. So as you're considering what kinds of projects you might be submitting to this particular opportunity, please consider the kinds of things that you've been thinking of doing, but you know, didn't fit into necessarily an existing system, that push the boundaries of what, you know, of expanding your program a little bit more into some of these what we call social determinants of health, the social, economic, and physical factors that determine a person's opportunities for health outcomes. If you're not already, okay, it looks like we have one additional question that just popped up by Kristen. Thank you. When you refer to school-based programs, does that include preschool or 0 to 5S? Absolutely. We are very interested in early childhood education. Have been recently supporting some outreach around the connections between early childhood education and overall health and opportunities. So we are certainly interested in supporting 0 to 5. For those of you that are online, I hope that you're already receiving our mailings and announcements, and that's how you got to this webinar. But if for any reason you haven't yet joined us on Facebook, you haven't yet joined us on Twitter, please be sure to do so. You'll see those our handles on your screen right now. We post only about once a day, sometimes a bit more to Twitter, but they are your opportunity to get more real-time information and opportunities that relate to building healthy, equitable communities in San Mateo County and advancing the 4 priorities of Get Healthy San Mateo County. We also encourage you to share Get Healthy San Mateo County with colleagues, partners that you work with, and others, so that they could join us on Facebook and Twitter and also start to receive our newsletters. We have consistently been putting out newsletters once a month, and they typically include just an overview of some key issues that we're interested in. We have a question by Madeline. Will you be funding projects or programs, for example, community-based research? It would be a new part of work aimed at changing environmental conditions. Absolutely. We are interested in supporting research, what we are calling action research, so research that engages the community and has a specific outcome related to the 4 priorities that we would like to advance. Great question. We haven't had a lot of questions about research to date, so we certainly appreciate that. Jasmeet would like to add.
And, yeah, this is Jasmeet. I just want to follow up that, you know, if you look at the RFP, it does say what kind of efforts will this funding support, and it goes anywhere from community education, collaboration and partnerships, city and regional planning processes, action-focused research, promotion of systems change, and technical assistance to advance solutions locally. So absolutely, it would certainly be eligible under that.
So Sarah, looks like Sarah had a follow-up question to her previous question about what I think was school support reading in K-12. Can you explain not funding projects with partial funding a little bit more? We absolutely provide partial funding for projects. We are excited when projects have other resources that they are bringing forth and are advancing. what my point was that we are interested in providing resources towards new projects. So if this has been an ongoing project that someone has undertaken for some period of time, an existing project, they're just looking for continued support to fill a staff person's position, that we don't see ourselves as the big enough funders, for one, to be able to sustain funding from year to year for existing and ongoing projects. I hope that clarifies your question, Sarah. So it looks like we still have 4 minutes, so I encourage you to send in your questions. Again, about the request for proposals, if you have anything you want to share about the priorities and the strategies, please do so. So as a reminder, you can get our strategic plan as a PDF on our website from the Get Healthy San Mateo County homepage. You can also access the application for the request for proposals for community implementation funding. You can join our Facebook, our Twitter page. Again, we can't emphasize enough what Jasneet mentioned around the application. We are trying to make the application process easier and more streamlined using an online application system, but it doesn't come without challenges. The challenge will be that you cannot save once you get started, and you cannot navigate using the regular Internet Explorer or Mozilla back and forward buttons. You must follow the application navigation bars at the bottom of the application screen. You'll also will not be able to save. Therefore, we strongly suggest that you save you fill out the Word version of the application on the implementation funding webpage, and you save it, and then once you've finalized the language in that, you open up the online application and you cut and paste into the answers. And therefore, if you do need to jump off for a second to answer a phone call, if you do accidentally navigate back and forth using your browser buttons, that you will not lose all the information you had started with. So with that, I think what we'll do is just pause another moment. We have 1 more minute remaining. We're happy to answer any final questions that you have. Again, as a reminder, we're going to be posting FAQs that we've been collecting from both questions that Rosa, HPP email, Jasneet, and other planners and staff have been receiving, that we received from the forum yesterday, and if you, not yesterday, Tuesday. On Tuesday. If you were present at that event, thank you for showing up. It's always wonderful to see all of you in person. Thank you for participating in this webinar with us, and continue to reach out to us if you have any additional questions, and we'd be happy to answer them and talk you through them. Have a wonderful rest of your day, and thanks again for joining us today.